My name is Stephanie Aid, and I am a postdoctoral fellow in the NeuroNetwork for Emerging Therapies. Diabetic neuropathy is one of the most common complications of diabetes, characterized by axonal loss. Diabetic patients experience chronic pain and eventually lose their sensation at later disease stages. Till now, there's no effective treatment for diabetic neuropathy beyond glycemic control, which does not fully prevent disease progression. That's why it is important to understand the molecular basis for diabetic neuropathy in order to design mechanism-based therapies. The mechanistic target of rapamycin, or mTOR, is a master regulator of growth and metabolism and consists of two complexes, mTORC1 and mTORC2. Now, both complexes have been implicated in disease pathogenesis, including diabetic complications. And evidence from our team show that there is a dysregulation of mTORC1 and 2 in human diabetic neuropathy. That's why our objective in this study was to examine the role of mTORC1 and 2 in the development of diabetic neuropathy and determine whether this dysregulation is conserved across diabetes types. So we treated mouse models of type 1 and type 2 diabetes with either selective inhibitors for complex 1 and complex 2 or dual inhibitors for both complexes. And then at study termination, we performed behavioral testing, metabolic phenotyping, and molecular analyses. We found that type 1 diabetes induced weight loss, hyperglycemia, and nerve dysfunction. While mTOR inhibition did not affect the metabolic phenotype, it did improve nerve function. We also showed that dual inhibition of both mTORC1 and mTORC2 in type 1 diabetes did not have an additive effect on nerve function. Interestingly, we showed that the mTOR pathway may signal through increased oxidant generation in type 1 diabetes to mediate nerve damage. With regards to type 2 diabetes, we showed that type 2 diabetic mice had increased hyperglycemia and neuropathy. Treatment with selective inhibitors for mTORC1 or mTORC2 improved nerve function. However, dual inhibition of both mTORC1 and 2 did not result in improved sensory nerve conduction velocity, but it did retain its protective effect in behavioral and in motor nerve conduction velocities. These results identify a potential role for mTORC1 and 2 in peripheral nerve injury in both type 1 and type 2 diabetes, and ongoing studies in our lab will determine the cellular and molecular mechanisms by which mTOR mediates nerve damage in diabetes.